Hello. Today, I'm going to discuss schizophrenia and transcranial direct current stimulation, also known as TDCS, the effects of TDCS frequency, duration, and electrode placement has on schizophrenia, and directions for future research. I'll start with what is schizophrenia. According to the DSM-5, schizophrenia is a spectrum disorder. It is characterized by disorganized thinking, emotions and behaviors that are often incongruent with their situations and disturbed perceptions, including delusions and hallucinations. The onset of schizophrenia has been found to be in the early 20s for men and the late 20s for females. Through MRI scans, it has been proven that patients with schizophrenia have disrupted white matter and substantially less gray matter volume in the affected brain regions, particularly the medial temporal, superior temporal, and prefrontal areas. These areas are associated with episodic memory, processing of auditory information, short-term memory, and decision-making. The decline in both gray and white matter accumulates to the disruption of interneural communication between brain regions, and inability to function properly, and structural deficits. Schizophrenia has 3 symptom categories. They are positive, known as thoughts and feelings that add to the experience. These symptoms include auditory and visual hallucinations, delusions, and paranoia. Negative symptoms, on the other hand, take away from normal behavior. These symptoms include flat affect, which can be a lack of response and expressions. Lastly, there are cognitive symptoms. This is presented as a deficiency in memory, both short and long term, disorganized speech, and abnormal behavior. The causes of schizophrenia are still unknown, although in the last decade there has been promising results in the use of electrical current stimulation as therapy, particularly TDCS, as a way to reduce the symptoms of sufferers. So what is transcranial direct current stimulation? TDCS is a neuromodulatory method that distributes low intensity, usually between 0.5 and 2 milliamps, of direct current to cortical areas via the anode and cathode to excite or inhibit spontaneous neuronal activity. It should be noted that TDCS does not directly induce cerebral activity, but rather alters spontaneous brain activity and excitability by subthreshold modulation of neuronal membranes. TDCS is used to assist the brain in restoring irregular and broken synaptic plasticity by modulating cortical excitability and has been proven to be an effective therapy for many mental and psychotic illnesses. Patients usually receive anywhere between 5 to 30-minute treatments for a varied number of sessions dependent on what is being targeted. Although it does not eliminate the illness, it gives patients a better quality of life by making the severity of symptoms more manageable. How is TDCS an effective treatment for schizophrenia? As schizophrenia has multiple symptoms in which affect various areas of the brain, researchers have used the placement of the anode and cathode to explore both bifrontal and unilateral effects on reducing specific symptoms and the severity. In bifrontal placement, where the anode is placed on the DL-PFC and the cathode usually on the supraorbital area, is usually the focus of reducing the effects of negative and cognitive symptoms. Studies by Smith 2015 and Gion 2018 discovered that the effects of this placement were met with improvement in cognitive symptoms but not negative ones, whereas Palm 2016 and Gomes 2018 had managed to reduce the severity of negative symptoms but with no effect in cognitive symptoms. The unilateral placement, on the other hand, seems to be favorable for reducing positive symptoms, specifically auditory verbal hallucinations, although limited studies have proven effective. In engaging the cathode on the fronto-temporoparietal cortex and the anode on the DL-PFC, only Brunlin in 2012 discovered significant results in reducing auditory hallucinations in comparison to Fitzgerald 2014, Froelich 2016, and Chang 2018. These studies had shown no effects at all. Another varying effect for reducing symptoms can be the duration of sessions and the frequency of stimulation. The key difference between Brunlin 2012 and the other unilateral studies was that he applied twice daily sessions in comparison to a single one. The 20-minute duration remained the same throughout the studies. In the bifrontal studies, it's interesting to note that both Gion 2018 and Smith 2015 had promising results for cognitive symptom improvement. Smith using a 20-minute stimulation session for 5 days and Gion a single 30-minute session for 10 days. In comparison to Palm 2016 and Gomes 2018, who essentially replicated the same study using a single 20-minute session over 10 days. It's difficult to reduce symptoms when the causes of schizophrenia are still unknown. The use of bifrontal electrode placement shows more consistency in providing results than unilateral placement. It seems there is yet to be a definitive structure for reducing auditory visual hallucinations, as Brundtland's study in 2012 has yet to be replicated. Tdcs shows promising results now and for the future as a continuing therapy for schizophrenia. Although there is no singular method that alleviates all symptoms, there are methods of placement, duration, and frequency of sessions that work for different patients. Perhaps a more personalized approach is applicable for patients with more prominent symptoms. The question is, how can this be improved? Future research should consider finding more evidence in the effectiveness for reducing positive symptoms in TDCS. The research provided has found limited effectiveness. The use of more randomized controlled trials with larger scale participants should be considered. Another avenue to consider is the refinement of where the electrodes need to be placed in order to gain the greatest effect from treatments. Again, this could be done with larger scale studies inclusive of sham sessions to compare. Lastly, it would be worth having follow-up studies on the patients who have been receiving TDCS as treatment for several years now, as a way of investigating the efficacy and adequacy of the treatment.